which is an inflammation of the prostate. There's also something called prostate infarcts. But essentially it comes down to the things we talked about. Is the rectal exam normal? Am I feeling something normal or am I feeling something hard? If I'm feeling something hard, I'm going to do a biopsy no matter what the PSA is doing, because we want to make sure that's the earliest cancer I've ever diagnosed was a nodule, a little hard spot on the prostate, and his PSA was 0.4. So it was less than 1, and he still had prostate cancer. That's why the digital exam is very important. But yes, it can flutter up and down, but if it is abnormal, then the patient should have a volume and a density and see if we need to biopsy anything. Because if you look at if it going up and down, if it goes up and down like this, that's fine. But if it goes up and down like this and it continues to elevate, that could mean cancer. And actually, this is a good time. If you look at the second topic, is PSA velocity. Again, with the research that goes on, researchers have been able to tell us that if your PSA goes up more than 0.75 in 1 year, even if it's 0.1 and it goes up to if it goes up to 2 in that period of time, that's, even though it's normal in terms of your age-adjusted PSAs, then that would be something that needs to be biopsied. So a rise of more than 0.75 in 1 year is also suspicious. So if it's bumping up and down, I wouldn't wait to see if it comes back down. I would biopsy that person when it goes up, because again, we're saving people when we find it early enough. So we wouldn't wait 6 months or a year to check it again to see if it's going to go down. We would ultrasound them at that time.
Are there any evidence that drugs that you take or any other thing that you might consume or situations and environments that would spike up the PSA level?
I wouldn't say spike it up, but we know that
Raise it up.
Not really. Other than the things we talked about, prostatitis, prostate infarcts, those types of things. Actually, the only thing, a medicine that would take it down is Avodart. Medicine like Avodart or Proscar shrinks the prostate. So what we have to do is we have to double the PSA on those patients. So you'll see if you go on Avodart or Proscar that your PSA will go down. So what we have to do to compensate is we double your PSA, and that gives us an idea of whether you're you have prostate cancer or if it's suspicious for prostate cancer.
Is usually a person that does have a high PSA or possibly has cancer in the prostate, is their zinc level low? Because I read somewhere that on the biopsies of deceased people, they did biopsies of the prostate, and the zinc level or content was extremely low in those people.
We're going to talk about that we have in terms of prostate health. We're going to talk about some preventative measures in terms of. But you're right. We have I'll talk about it a little bit now. We have a medicine out. The American Urological Organization, American Urological Association, really stayed away from preventative therapies for years, and now they're starting to allow, and only because there's been good data. There's a company that the AUA now has agreed to allow urologists to use their drugs, because this company has gone through and used clinical trials, and they have followed FDA guidelines in getting these medicines to the public. They don't usually support medicines that are made overseas that haven't followed these guidelines. You remember, the vitamins and nutrients, there's no FDA guidelines on the vitamins and nutrients that you take. So a big medical organization is not going to support those supplements because they don't know how they're made. And now there's this company out that they do support that follows rigid guidelines like the FDA would. So we'll talk about that at the end. And I have some brochures in the back for various urological, it's part of the prostate health. We got some pamphlets out back, and please pick those up on the way out, but we'll talk about those in a little bit. But no, nothing you can do except for prostatitis and prostate infarcts that would make it go up, and medicines sometimes will make it down, one class of medications.
What about salt palmetto?
Salt palmetto is certain. We have a pamphlet about salt palmetto. It's proven to be effective in a certain percentage of men. Doesn't drop the PSA. It helps relax the prostate by unknown reasons. Salt palmetto has been used for thousands of years, starting with the Mayans, and it has helped with prostate health. And we do have a pamphlet back there, and there is a supplement, a salt palmetto supplement that you can take if you would like to try something natural as opposed to medical therapy.
How the Mayans find out?
I'm not sure how the Mayans. I'm not sure how they.
Is that FDA approved?
Again, all supplements and all vitamins are not FDA approved, but that's part of this, right? Studies on patients were run for these medications, and they've been, the American Urological Association has said that this company's products are something that if you're going to take a supplement, this is the kind of supplement you should take. Stuff, what they're saying is stuff in vitamin stores that's not made in America, that do not follow these guidelines, or something you probably don't want to trust. I don't know whether anybody saw the article, actually the 60 Minutes on supplements, but it was pretty amazing. Some people have died. Some medicines have been laced with certain substances, and people have died taking supplements. And some patients take too many supplements that aren't necessary. So it's certainly something you have to ask your doctor.
I believe I've read that Hopkins or somewhere is coming up with a different diagnostic test, not based on PSA. Have you heard anything about that?
I wouldn't, and you know, Hopkins has a lot of money, and that was part of the what I was talking about in the beginning. They have a lot of money. They can get articles published. They have a new test coming out all the time, and I don't think any of their tests have ever come to be used by the American Urological Association. So these are people who are doing research. They're trying to promote their product so that they can sell it, and the papers are. So about every 3 or 4 months we hear about a new test, but nothing's ever been proven to be effective and useful. So.
What you're saying is the supplements are not FDA regulated.
Exactly.
Can we trust the product of the supplement maker? They are famous names or something?
Again, you're taking a chance in taking a supplement unless Dr. Ross recommends something that he trusts and he believes in, or something that I trust. For years I never trusted any supplements because, again, a lot of this stuff is made overseas. There's nobody monitoring who's making these pills. And
I'm talking about U.S. manufacturing.
well, that's the point. A lot of U.S. manufacturing is made overseas. So unless you know what's going on with the supplements, I mean, people are putting down a lot of supplements, a lot of vitamins that they don't need. So that's the important thing with if you're doing this, talk to Dr. Ross and see if taking mega doses of vitamin C. I know there are articles about mega vitamin C can cause cardiac disease. So I mean, it's just talk to Dr. Ross if you have supplements, questions about supplements, because it's a pretty important topic.
We could talk about it, but one of the things I've been trying to do forever is to try to make sure if there are supplements that we recommend, that there's reasonable evidence in the medical literature, not anecdotal and not studies only done with mice, and that the products are tested for purity and potency in post-production testing, so that they test by batch, and they submit each large lot that's manufactured to an independent laboratory that looks for contamination on the one hand and looks for potency on the other. And then when all that's done, there's still the issue of bioavailability. You might take something that your body can't absorb, but we could talk about it another time.
Any other questions?
Just had a quick, you mentioned class of drugs, Avodart and Prostate, but there are all kinds of other BPH drugs, and there's also heat therapies. Do you take those into account when you're monitoring the PSA?
Well, if all the alpha blockers do not lower PSA. Now, if a patient has a procedure, if a patient has a TURP where we scrape out some prostate tissue because a gentleman's having difficulty urinating and we remove that tissue to enable him to void, then the PSA would expectedly go down at that point based on loss of tissue. But so a lower number is usually not a problem.